my honor and pleasure to be welcoming Kim Baranek to do this session on sexual orientation and gender identity for children and youth with special healthcare needs. So welcome, Kim. I just want to let everybody know that Kim currently works as the Outreach and Education Specialist for CCS in the Alameda County Public Health Department. And she comes with a lot of experience, and I know she's going to talk more about her all her work that she's been doing. So over to you, Kim, and thank you.
Thank you so much, Pip. Appreciate that warm introduction and the opportunity to be here with you all today. So I want to share that my pronouns are she, her, and hers. Happy to be here presenting Alameda County CCS. I also bring experience promoting child, youth, and family health for several years, primarily in schools, and also as the former director of an LGBTQ plus youth program in communities in schools. And I'm also here bringing lived experience as a queer, gender nonconforming woman. I'm going to go ahead and share my presentation slides with you all. Can you see those?
Yes.
Thank you so much. I appreciate that. So role models and allies are just incredibly instrumental and important in really supporting children and youth to thrive. So before I get into the agenda and objectives, I just wanted to take a moment to acknowledge that family members, those of us here today, providers can all play this role as role models and allies. And sometimes we also can find folks in media such as Kay Nwande Barrett, who can be role models for young people. And I'd really hope today to be here as a moderator with a panel of youth with lived experience, their families, and providers who are experienced in serving them. However, that didn't pan out. I think often it can be vulnerable for youth to present in front of a group of adults. So, perhaps it's something we can do in the future. But I do have some videos and media to bring in youth voice. And I wanted to acknowledge that I'm not here as an expert in this topic. It's something I'm super interested in, this intersection of sexual orientation, gender identity, diversity, and special healthcare needs among children and youth. And I think there's a huge gap in services and awareness around this intersection that I thought it was important for me to come today and present, even without a panel, to bring this awareness forward and to really expand this conversation. So just invite that connection beyond today for those of us who are interested in inclusion, and to work together to see what else is possible, because there really is a major lack of services out there. Please do ask questions and I'll do my best to answer them as we go. So I hope that as a result of today's session, you can expand your awareness of sexual orientation and gender identity diversity, increase your understanding of needs of children and youth who experience special healthcare needs, who identify as SOGIE diverse, and can walk away with some affirming practices to really help support children and youth. So I'll start off going through some terms just to give us all some common understanding. And then I'll just talk a little more about this intersectionality of SOGIE and disability and special healthcare needs, share some data about risk and protective factors, and then talk about the supportive practices that we can all engage in to be there for young people, as well as some resources. There was a resource sheet that is already shared for the session, so I hope you've been able to access that, and I'll be referring to it throughout. So I invite you all to be present in this session, and this really is a learning space, so there's no silly questions, and please don't worry about the way you frame questions. We're all here to learn together, to listen and share experiences. And again, I am by no means the expert, so I do welcome your voice here in the session via the chat. All right, so jumping into some terms here. What is SOGIE? Well, SOGIE really is describing two separate but related parts of our identity. Our gender is who we are, whereas our sexual orientation is about who we love, who we are attracted to. And it's based on our own gender identity and the gender identity of those to whom we are attracted. I'm going to be focusing a lot more on gender today because I feel that that's a lot more of a growing edge for most people who are more familiar with sexual orientation. But if you want more in-depth information, please do ask questions. And so I'm really coming in to the presentation with these understandings in mind about the SOGIE diversity that exists in the world, and that how we identify really has a lot to do with our culture and how we see ourselves either fitting into, not fitting into our culture. And then acknowledging that SOGIE diversity has existed throughout history, cultures, geography. My presentation seems to be frozen. There it goes. And then just a little bit about why am I using this term SOGIE and why am I not talking about LGBTQ, lesbian, gay, bisexual people? Because SOGIE includes the full spectrum of identity. So from heterosexual through bisexual to queer, from cisgender to non-binary to transgender. And if you're not familiar with those terms, we'll be getting to them in just a moment. And really honoring some people do not label sexual orientation and their gender identity. They may be just more fluid. And so as a way to honor that, I may say SOGIE diverse. So meaning folks who are in the minority regarding sexual orientation or gender identity. And in public health, a lot of times they'll use the term sexual and gender minority. I tend to say SOGIE diverse. However, I will be referencing some studies where they characterize people as LGBTQ. So I'll be following whatever the study uses when I'm talking about those. All right, so this is an excellent educational tool from transstudent.org, and it's included on the resource sheet with the link. I'm going to break this down into parts because I find this graphic a bit much to take in. Before I did that, I just wanted you to see the whole thing and to see these lines and kind of explain the symbolism here. So for example, with gender identity, the left end would mean that someone you could sort of plot yourself. If someone had no felt sense of female identity, they might mark themselves here. And this is to like a really great amount of feeling female, like a high amount. And what it acknowledges that some of us may think of our gender as both female and male, and as other genders, as some folks do not have a real felt sense of gender and may not plot themselves at all, but it just recognizes the diversity in SOGIE. And I think I've used this tool with young people, with adults, as a great conversation starter. And I found it's a great practice to reflect on it for myself before asking someone else to reflect. And then also acknowledging that this type of lines and symbols just don't represent everyone, and folks may have their own symbols and ways of talking about their identity, and this can kind of open that conversation. So first, let's talk more about gender. And I'm going to start at the bottom with sex assigned at birth. So, this is what's assigned to an infant, and most often based on the infant's anatomy and other biological characteristics, especially genitalia. And some babies are born with variations in physical characteristics that do not fit into a strict medical definition of male and female, and call that intersex. And so using the term sex is often used. Sex assigned at birth is a preferred term because it really acknowledges that, the infant, of course, does not have the cognition to know what their gender identity is. So it is what's assigned to them. And it acknowledges that many people understand their gender as something different than what they were assigned. And that can happen as early as a child is verbal. There are instances of age 2 and 3 when a child is asserting a gender identity that's different from what they were assigned at birth. And so gender identity really, again, is that felt sense internally of who we are and how we label ourselves as a woman or girl, a man or a boy, maybe neither, maybe both, or some other terms that I'll describe in just a moment. And our gender expression is really, how we show up in the world, our style, our hair, our clothing, the roles we play, and how they line up with what our culture considers feminine and masculine, or maybe more non-conforming in that regard. Again, I do identify as gender non-conforming, and so my expression, I was assigned female at birth. My expression does not line up with that. It is more masculine. And I share that just as an example so that we can all learn, and then also I find that disclosure can be really helpful in talking with children and youth, and having some comfort around it can help them to build comfort as well. The other thing I want to say is that, we really can't know someone's identity, their concept of who they are, just by looking at them and their expression. There are people who identify as female, like me, who have a masculine expression. There are people who just identify in all kinds of ways, but show up in all kinds of different ways. So it's just important we don't make assumptions. And then just a little more details here in the definition on intersex. The source of all the SOGIE terms definition is here at the bottom and on your resource sheet as well. And just to note that some people really embrace intersex as an identity, whereas for others, they view it more as a medical condition, speaking more to their physical biological traits. And people who are intersex may identify as any gender and any sexual orientation. All right, so let's talk a little more about gender. And, our society here in the US is really set up around a gender binary, this notion that there are only two sexes, two genders, kind of two set ways of expressing our gender. For example, a girl or a woman has a vulva and a uterus, developed breasts, and is nurturing, right? And boys or men have penises, testicles, develop pec muscles, and are, monetary providers. These are norms in our society that don't reflect the full diversity. And related to that is cisgender, or cis, sometimes it's shortened. This is when a person's assigned sex or gender, assigned sex, and their gender identity and expression do not all line up. So a cis person may have been, if you look at the blue box, they may have been assigned male at birth, identify as a man, and express themselves in a masculine way. So, I shared earlier that although I was assigned female, identify as a woman, I don't express myself in a feminine way. So I don't fit into this definition of cisgender, and cis means same, or on the same side. Okay, so, for cisgender people, it tends to be a little easier to walk in the world. You can find a restroom that matches your gender. You can go into clothing departments that tend to be very binary and fit your gender. But for those of us who are not cisgender, it's a very different situation. I myself have experienced harassment in women's restrooms, and this is a major issue for gender diverse young people. In a recent survey, half of all trans and non-binary youth said they can never use a school restroom that lines up with their identity, which means most of them avoid using the restroom. So they don't eat and drink during the school day. So this can add, of course, major health issues, including urinary tract infections. So this binary setup really can be problematic. So sort of the opposite of cisgender would be transgender. So people whose gender identity does not line up with their sex assigned at birth, or do not fit into these cultural norms of the binary. So actually many trans people identify as male or female. So they actually, those are really more binary, although we would consider them outside of that binary, but they do identify in that way. So using the terms female to male or male to female can be really offensive for folks, because their felt sense of who they are oftentimes is who they've always been, not the gender they were assigned. So saying F to M like implies that they were a certain gender at one point and now they're another. Whereas many folks feel this is the gender who I am and who I've been. So we want to stay away from, first of all, we want to know how people identify, and I'll talk more about how to ask. But we want to stay away from FTM and MTF. And then also just please to note that transgender does not have an ED at the end. It's often mispronounced. Yeah. Okay, so if you ever see the word trans with an asterisk, that's really referring to the term being used as an umbrella term. So meaning identities that are not cisgender. And these are some other terms for folks who identify as outside of the gender binary, and I'll go through those in a minute. So earlier I talked about cisgender really not fitting me because of my non-conforming expression, but I don't consider myself transgender either. So understandings of gender are very individual and often can be complex. But again, this is why it's really key not to make assumptions about people's identity and not to assume their pronouns, which is why I always introduce myself to really anyone that's new with my pronoun. And some people have gender expressions that either, simultaneously they represent masculinity and femininity. In Native American culture, the term is two-spirit for folks that embody multiple gender expressions and roles. And some folks express themselves in more masculine manner one day, maybe more feminine manner another day, that may be called gender fluid. So that's another reason, by looking at someone at one point in time, you may not have the full understanding of who they are and how they express themselves. All right. So here are the full definitions again of these identities that are outside of the binary. And some folks really have no felt sense of gender. They may identify as agender, and they may use pronouns and they may not. So they may just go by their name and like to be called by their name instead of saying he or she or they. And so here are some examples of pronouns, and it's by no means an exhaustive list. So at the top, the more common he, she, they pronouns are listed. It's good to be aware of these so that if you ask and you're among folks who use different pronouns, that you have some familiarity. So for example, someone who uses co-pronouns, You would say, I was talking with Co, and Co shared that Co's gender identity is non-binary. They think of Co-self as outside of the gender line, for example. Please check out the article for more information about pronouns, and just note that if you misgender someone, if you make a mistake and use the wrong pronoun, it happens. A lot of us are learning. This is new to our society. And what's important is not to dwell on it and keep apologizing. So you want to correct yourself, make a quick apology, and move on. Because it's not really fair to ask someone who's been misgendered to kind of process your guilt around it and be reminded of an unpleasant experience. So apologize and just move on is what's recommended. And if I'm missing any questions, if folks could just call them out to help me out, that would be wonderful. Okay. So in terms of asking about people's pronouns and the name they go by, again, I just recommend modeling that yourself in your interactions, and to practice asking to, professionally, everyone you're interacting with, all clients, family members, and just letting them know we ask to everyone to honor and respect who they are. I think it's a newer practice that's becoming more familiar, and the more that we all do it, the less of a big deal it'll be for folks. Including these fields on forms is super helpful so that all staff who are interacting with clients and patients really know how to address people. It's important to use words like name on legal documents versus legal name. It's more respectful. People's name that was given to them at birth or appears on legal documents, for people who are gender diverse, they may call this their dead name, literally meaning that name is dead to them. It does not reflect who they are. And having that called out, say, in a waiting room or any public space, can be very traumatizing. So we want to minimize that by talking to people in private about those things, and giving folks an opportunity to write them instead of verbalizing them. It can be helpful for those who can write. And having conversations about when do you need to ask a dead name or what's on a legal document, or sex assigned at birth. Why are you asking? Is it for insurance purposes? And to whom you need to disclose that? And where does a client or patient have the opportunity to choose how that information is shared? Particularly with young people, there can be safety issues for them around their safety and comfort, maybe even with other providers, in sharing different parts of their identity. They may feel more comfortable and use a certain pronoun with you that they don't use somewhere else. So you want to check in. Just a little more on sexual orientation. So again, who we're attracted to, who we love. The terms really depend on our gender identity, and recognizing here that we may be physically or emotionally attracted to more than one gender, multiple genders, and that some people only experience physical attraction, not emotional, and some only emotional, not physical, and some really experiencing neither. These folks may use labels such as asexual. So encourage you to, again, check out the glossaries on the resource sheet for more terms, but I want to make sure that you know what pansexual means, because it's increasingly popular for folks under the age of 30 to identify as pansexual or pan. And these could be folks who are attracted to people of multiple gender identities, or some people who are attracted to folks based on other characteristics beyond gender. When I worked in my youth group, this was the most popular orientation that the youth identified as, really beginning at age 12. So this term's live for them, so we should know it. And then queer, used then as an umbrella term for not heterosexual, and sometimes also by folks who are attracted to those of multiple gender identities. And so we should remove these from our vocabulary. Homosexual has been used in a pathologizing way and is very, very clinical. Some people within the community still use it, but for many it is offensive. You should replace hermaphrodite. You should replace intersex for hermaphrodite. And if we don't know someone's gender, we shouldn't use these sort of combination words to try to guess. We should ask or just use their name. Many institutions, including the American Medical Association and American Academy of Pediatrics, have asserted that SOGIE is not a choice. So we want to refrain from talking about lifestyles and preferences that sort of would say that sexual orientation and gender identity are choices. You know, I think of preference more as like, what do you like on your pizza, right? Whereas these identities are about who someone is, who we are. Young people are offended if you don't use the word queer. Folks, I'm in my 40s, I would say folks kind of around my age and older, for some, it's been used as a slur against them. So it's just important to kind of know your audience.
Kim, we do have a question from Lisa. It says, is bisexual and pansexual the same?
Good question. So bi meaning two. So I think typically folks who identify as bisexual are attracted to two genders, whereas folks who are pansexual may be attracted to people of more than two genders, people who are non-binary, or may be attracted to folks for other reasons, like outside of gender. Like I'm attracted to someone irregardless of their gender would be what a pan person would say. Is that clear? I hope. If not, ask a follow-up question. Thanks for letting me know. Okay, so talking just a little bit here about SOGIE identity development. These are parts of our identity that are interconnected, and they are influenced by all of these things, right? And we could also talk about this as intersectionality, that all these aspects of our lives, our relationships, our environment, our health status certainly play a role in our self-acceptance and being able to come out as SOGIE diverse, and really in youth thriving as their true integrated selves. So these can all be barriers or supports, right? Sources of discrimination and rejection, or sources of love and support and advocacy. And despite all that SOGIE diverse children and youth go through, you know, if they have at least one supportive adult in their lives, they have much better outcomes. Unfortunately, there's really very little data about this intersection of SOGIE and disability and special healthcare needs. This is from Movement Advancement Project and pulling together multiple surveys. So the US Trans Survey shows that 40% of trans adults in the US have a disability compared to 27% of the general population. So there's definitely disparity there. In California, 25%, so it's more similar to the general population, but you know, I believe that if you look at individual groups, as Washington has these numbers here on the right, that in California, there are probably some disparities among particular groups within the LGBT community as well. And very little data for children and youth. Really I couldn't find anything on special healthcare needs, only on disability. So much work to do, particularly for LGBTQ organizations, to be more inclusive. So there was a large survey of 12,000 LGBTQ youth, of which 15% self-identified as having a disability. But then, you know, I suspect that number is much higher since 16% were unsure. And then feeling safe in the classroom for LGBTQ teens, those with a disability were half as likely to report feeling safe, right? So we know that this intersection may have some increased risk for young people that we need to pay attention to. So let's get some youth voice here in the room. So patient with me for a moment as I switch to this video. Can you see the video screen? It's kind of a rainbow.
Yes.
Thank you. Let me make sure the sound sharing is on. It is.
Hi, my name is Annie. My pronouns are she and her. I identify as gay, lesbian, queer, and I'm a wheelchair user.
Hey everyone, my name is Erin. My pronouns are she and her. I'm bisexual and I have cerebral palsy.
Hi, I'm Rachel Ann. I identify as queer and my disability is Ehlers-Danlos syndrome.
Hi guys, my name is Robin Lambert. I'm 19 years old and I'm living with a disability called cerebral palsy. I use she and her pronouns, but I'm not, super fussed about it, whatever. Really, I'm not bothered. I really prefer not to have labels. I find them quite restrictive, and for my personality, I kind of just feel that, I'll like who I like at a certain time, I'll dress the way I want to dress on a certain day. I'd rather people just see me for Robin rather than for these other things.
What are some
So I hope you take time to watch the rest of that video and hear more about these experiences.
Kim, that was a wonderful video, and I don't want to interrupt you, but we do have some questions. Are you ready to take some of them before you move on?
Sure, please do go ahead.
Okay, one of the attendees here is asking, why is homosexual heterosexual offensive?
I'm not so sure about heterosexual being offensive, but homosexual has been used in a very clinical and sort of pathologizing way. It just doesn't feel friendly to a lot of folks in the community. And homo has been used as a slur quite a lot, so that's even tends to be more offensive.
Okay, thank you. And another question is, do you have recommendations on how to communicate the medical information related to sex? Oh, I'm sorry, I didn't finish that. I didn't. Do you have recommendations on how to communicate the medical information related to sex assigned at birth? The organs and hormones that a patient has are important for physicians as we think about diagnoses and treatment of medical conditions. It matters if people are taking exogenous hormones, and have had any surgical operations as well.
Yeah, I think that is where that conversation is important and key. And I think what is important to remember is not getting into extensive conversations about anatomy and genitalia with folks who are coming in for other reasons, like an ear infection or something like that. I think that's part of the point. And I think in having those conversations with gender diverse people, one important recommendation is to ask them how they name their body parts. That might be very helpful in having them really define terms and just having an open dialogue about how to have a conversation and an exam that's most comfortable for them, giving open space for the patient, to really talk through what would help them to feel most comfortable. Without a whole bunch of more time, that's probably the best recommendation I can give right now, but I can also follow up with some resources that have more information on that.
That's great, Kim, thank you.
And people can feel free to email me as well. Any other questions?
No, not at this time, and thank you very much.
Of course. I'm gonna take a deep breath before I present this. This is a tough situation for LGBTQ youth. This was a large survey from the Trevor Project last fall, 35,000 LGBTQ youth. And for decades, study after study is showing higher suicide attempts and suicidal ideation among LGBTQ youth. 42% seriously considered among these participants, and more than half of trans and non-binary youth seriously considered suicide at the time they were surveyed. So, I always say this work is about saving lives. This data supports that. Even learning one affirming practice today can really help a young person. 86% of those surveyed wanted mental health support. So 86% of 35,000, that's a lot of young people, but only about half of them got to see a counselor. There's a huge gap that we need to fill here. And they had a hard time at home during COVID, being at home more. Only 1 in 3 reported having an affirming household. So again, work we can do to support parents and families in accepting their children. And then looking at intersectionality here, the mental health needs of children with special healthcare needs has been well documented, and access to mental health has been an issue. And then here, staggeringly higher rates of anxiety and depression among children with special healthcare needs compared to peers without those needs. And, again, I'm just really at a lapse of finding data on intersectionality of health outcomes for this group. So a lot of work that can be done here for those who are researchers. I'm going to skip this in the interest of time, but it's important to know that youth of color and LGBTQ youth of color in particular are overrepresented among homeless populations. And again, there's a lot of intersectionality represented here, but we're still not including healthcare status. I have another fun video I'd like to share from Amaze. I encourage you to check out their videos on sex ed, SOGIE, for young children, all the way up to older youth. We use these with our family. They're informative, they're great conversation starters. So I hope you enjoy this. Can you see the video?
Yes.
Thank you.
Great. So I'll see you at 7.
Hey Alex, was that about Young Inventors Club? Tonight I'm unveiling my latest creation, the pizza taco. It's gonna be incredible.
Oh, sorry, I was gonna tell you. I can't make it tonight. I'm actually going mini golfing with Jillian Peters.
Jillian Peters, student body president, first chair clarinet and stage band, 5th level warlock on our ongoing medieval role-playing campaign. She is so cool. I didn't even know you were into that.
Medieval role-playing games?
No, like, dating. I mean, I hope it's okay to ask, but can your parts do stuff?
Actually, my parts work just fine. Just because I'm in a wheelchair, it doesn't mean I don't have crushes or feel attracted to people. In fact, no matter what our bodies can or can't do physically, people with disabilities have the same sexual and romantic feelings as anyone else.
And, like anyone else, people with disabilities have various sexual orientations and gender identities too. From heterosexual to gay, cisgender to trans, across a full spectrum of sexuality.
But are relationships more difficult for people with disabilities?
Well, regardless of my physical ability, I want the same things from a healthy relationship as everyone. Respect, communication, consent, and fun. And like everyone, I sometimes have questions about relationships. Like, how do I know if someone's interested in me? How do I ask someone out? Or how do I turn someone down if I'm not interested?
Putting yourself out there and trying to date can make anyone feel nervous or scared. But the more you educate and understand yourself and your own value, the better you'll get at feeling confident and making healthy decisions.
There are certain issues that people with disabilities could be more likely to face. Sometimes it can feel like parents are overprotective when it comes to dating. Or friends might not think of us in a romantic way because they don't understand that we have the same kinds of feelings. And there are some specific challenges that a person with disabilities might have to deal with. For example, if you had trouble communicating verbally, you'd have to find ways other than speech to express yourself or give consent. like using body language, adaptive devices, or pictures.
Think of it this way. Everyone's body is different and needs help from time to time. And regardless of a person's physical ability, they can have the same feelings, hopes, and dreams as anyone.
Thanks, guys. I think I get it now. Sorry I didn't understand before, Alex.
It's okay.
And you know what? I've got...
All right. So please do check out Amaze. I think their work's really impressive. And young people in my life have definitely responded well to these videos. So let me go back to the slides here. And I appreciate it. Whoops, sorry about that. The inclusion of physical disabilities. Again, I hope there are more and more resources in the future to talk about other health statuses as well. And can you see the slides now?
Yes.
Thank you so much. So to summarize about risk factors here, just there are overlapping factors for youth who are SOGIE diverse and experience special healthcare needs. So we really need to be watching out, assessing for bullying, bathroom access, missing school for reasons related to illness, injury, but also safety, right? Especially if bullying's happening, and for accessible restrooms that are also gender neutral. So we'll talk more about healthcare in a moment, but for children and youth who live at these intersections, we can, I think, surmise that the risks for them are greater. And just a quote here from a student about that experience for them. So I've kind of talked through, the harm of reinforcing the gender binary, of course, reinforcing ableism, and the harms to that. And I think we see depression and anxiety at such high rates for children and youth who are SOGIE diverse and have special health care needs because we don't have systems in place or trained staff who really can prevent the reinforcement of ableism and the gender binary. I think that it's important to reflect on these and revisit them repeatedly, and then also that the resource sheet has a lot of guidance on how to prevent harm and engage in really affirming practices. And I'm talking so much about gender affirming language because it really is life-saving. And thanks to the Trevor Project, we now have data that confirm. So trans and non-binary youth were much less likely to attempt suicide if everyone in their household respected their pronouns. So attempted suicide at 13% versus youth who lived in households where no one was respecting their pronouns, which had a 24% attempted suicide. So again, using affirming language, asking about names and pronouns is extremely important, and avoiding assumptions. And just really letting youth know that you see them for who you are. When you use the name they go by in your pronoun, you're telling them that you see them for who they are and how they know themselves. I really cannot say enough about the connection to peers and role models. I've seen that be an extremely transformative experience for so many gender diverse young people and those with diverse sexual orientations. Being around someone who's lived through their experience, and especially those who are doing really well and thriving and have come through some really tough stuff, can be extremely empowering. There are support groups listed on the resource sheet to help you make that connection, a lot of online connection as well. And, really to say that because there's so much in society that is negative, and because of what youth traverse and children traverse, it's important to really signal that you're a safe and affirming person over and over. Like, you can never do that too much. And to show that visually with signs in your offices and in the way you talk and communicate. It's, there's so much right now happening in politics about banning healthcare for transgender young people, banning gender diverse kids from participating in sports. Like, all of that going on impacts them. And so having that open dialogue to ask how they're feeling about those things and really checking in with them is super important. Some great data from Family Acceptance Project and the guide on your resource sheet showing the more accepting behaviors the family exhibits, the better health outcomes for their children, which means they're less likely to be depressed and attempt suicide and less likely to have substance use issues. In another youth survey from Human Rights Campaign, 67% of LGBTQ youth reported hearing family members make negative comments about LGBTQ people. So all of that does have an impact. I know that many of you here are here as supportive, accepting, and loving family members. And I think that's what's important, is that love. And going from that place of love for your children, no matter who they are. So, just remembering that and knowing that, I think for families, it's being kind to yourself and patient, and accessing supports and materials. If you have a child in your life that's sharing a new understanding of identity, that you're going to go through your own journey. Often for them, they've sat with a while, maybe, before they're disclosing to adults close to them about their identity. So they may be a little more ready to kind of be out in the world as who they are. It can be really hard for them to understand that parents go through their own, grieving and accepting process. So it's really important that you get support from other parents and from professionals, such as those on the resource sheet. So then you can show up for your child and to advocate for them, because they really do need advocacy, be that with other family members in schools and with providers.
Kim, thank you. My interrupters, we've got a question from Dr. Lewis Gerling, I believe.
Yes.
Dr. Gerling. He is asking, what words would you advise clinicians to use when asking about sexual orientation? Some use to offer, are you straight, gay, or bi? This might no longer be a sensitive way to ask, especially for youth. Can you comment on that, please?
Yeah, I think no matter what the options are that you give, you should always leave an open-ended option or another. Do you identify in another way? And I think the other thing to remember is not to just ask how young people identify, because many are either fluid or don't like to label. So it's important to ask about behavior. For example, when giving guidance on sexual health and education, you would want to ask, tell me about the gender identities of people that you engage in sexual activity with, right? So it's not just identity-based, it's also behavior-based, because their health risks and health education is going to depend on how they respond to you, right? What type of birth control methods or STI protection is most appropriate.
Yeah, thank you, Kim. Thank you. Okay.
Sure. Let's just take a minute to hear some voices of youth on healthcare. So just bear with me as I transition over to the video.
And Kim, just to let you know, we have approximately 8 minutes left.
Great. Thank you. Can you see the video?
Yes.
Thank you.
I would like to be asked what pronouns to use, because for me, when somebody says he, it really, really upsets me and almost like breaks me down. And then it's like, oh, I might as well just leave, because I'm sure I can handle this on my own. You know, I came to you for help and you just, you know, ruined my entire, you know, week.
Jordan, when would that happen to you? Like, when would it feel best for that to happen? Is that like over the phone? Is that on the form?
I think on the form, because, I mean, that would be a little bit weird to be, you know, what pronouns do you use, you know, making your appointment. I feel like that would be a little bit too in your face.
Have you ever encountered problems filling out forms or like frustrations with having to like check certain boxes?
Yes. That male female box, that yes, because I want to mark female and legally I can't, and that irritates me. Or I might be on the phone with them and they may say, well, what is your gender? You know, and I have to tell them what my legal gender is, but that really frustrates me. It does.
Do other folks have similar experiences with that or different experiences that you would want to talk about?
They actually asked for your like preferred name, and I put it down. And I was like, yeah, like they're going to use it. And they didn't. And I was like, so what was the point of me putting it down if you're not going to? So like, yeah, I get that there's the good intention, but like you're not going to implement it. There's no point of putting it there.
If you could.
Okay, I'm just going to skip forward and show another clip here, but please, if you can take the time to go and watch the rest of the video, I think you'll find it very helpful.
You don't know what we're going through, and a lot goes on in our heads because we have to deal with the world accepting us being transgender, and health is something that is a big concern with us.
I think for me, one of the biggest problems I encounter is that whenever I go to the doctor, I end up telling the doctor more about my body than the doctor tells me, because they just don't really understand stuff or understand how things work, which I get, but also it's kind of their job to know. And I feel like, I mean, and I know that like hospitals are supposed to provide training for them and stuff like that, but they don't. And so it ends up being, you know, because trans people's bodies and what they're experiencing and what cis people go through are totally different in a lot of ways, but in a lot of ways they're not, and they don't really know where that is, and what kind of boundaries those things have. And it just gets really weird sometimes.
Can you just talk a little bit about what it feels like to sit in the lobby?
You know, after you done signed in, and especially like me, I don't have my name changed legally done just yet. My gender marker is not legally changed either. So it's kind of hard for me to have to sign in and, you know, give up all my documents and stuff like that. And whatnot, I retrieve them back and then wait patiently for the doctor or somebody to call you out. And then you're just waiting on that door to open and you're just like, oh God, what are they going to say? What are they going to say? How are you going to do this? You know, and then when they call your name out, I mean, you kind of don't want to just sit there because then they're going to look at you and be like, hey, they just called you. No, they didn't. No, they didn't. No, they didn't. Wrong person.
All right. So I think, you know, these suggestions and youth experiences are helpful, you know, not just for a medical setting. I think that many providers could really learn from this. And what I heard, whoops, sorry about that. What I heard is really a call for providers to engage in self-education. And I do have some training resources on the resource sheet. And also, you know, just hearing what it's like to sit in a waiting room and be so anxious that someone's going to call out your dead name being a very tough experience for gender diverse people. So my screen does not want to advance. Another video on here that I encourage you to check out later, more voices around healthcare experiences. So what can providers do? So, you know, if you have an inclusive form in place and staff all know, you know, what name to use to call someone in, you can completely prevent the anxiety that the young person just shared about of sitting in the lobby. And again, just really making sure to talk through with youth confidentiality and privacy, you know, what needs to be shared and why, and with whom it needs to be shared, and what that feels like for them. You know, youth shared a lot of frustration around that. Providers definitely assessing for risk, you know, given the data shared around these health outcomes, and really arming yourself with materials for patients and families that are inclusive of their whole identities, that are age specific, and also developmentally appropriate. There are a number of gender specialists out there. We're very fortunate, particularly in the UC system. They have a wonderful gender clinic where children and youth can be referred. Kaiser also has specific services for gender diverse patients, as well as some others listed on the resource sheets. And really being an advocate for your patients as they go on to other providers, really promoting SOGIE inclusivity, sharing resources that have worked well in your practice to support them. And lastly, you can offer a cue card, a little card that young people can write in their identities and hand to a provider. And the other side has tips for providers in providing affirming care. And I think this is a jumping off point, obviously only usable by youth who can write, but I think there's a lot of opportunity to, make this into something more accessible and provide other formats.
Kim, we have about 1 minute left. And just to let you know, I did drop your resources into the chat.
Thank you. Appreciate that. Well, I'm on my last slide, so this is all working out great. On the resource sheet, you will find things like crisis support services from Trevor Project, as well as social groups and chats for them. You'll find books such as Who Are You? Great resource for all ages to talk about gender diversity. And the Refuge app, which helps people to locate accessible and all gender restrooms near them. You can put in an address and it'll pop up a map with those locations. Can't say enough about the wonderful resources in the Bay Area, such as Gender Spectrum and Somos Familia, offering support to Latinx and Spanish-speaking parents and families of LGBTQ people of all ages. Really appreciate you all joining me today. I really hope to continue this conversation with you all. Please do connect for other opportunities to talk about how we can fill some of these service gaps. And if I can answer any further questions, provide resources. I do know a lot of trainers in the area for folks who are interested in continuing their education. Thank you all and be well.
Okay.